They're going for it. Preemptive COVID measures. I've been saying this for months. They're not even going to wait to see how well the vaccines hold up before they mandate boosters. That's right, mandatory boosters. Mandates for all businesses here in New York City. This is just a step shy, really, of the complete madness we are seeing in Australia. Here is the mayor of New York, the worst mayor in America, perhaps one of the worst in the world, we'd have to check, Bill de Blasio, announcing his sweeping new mandates that affect businesses, children, boosters. Check it out.
We've got Omicron as a new factor. We've got the colder weather, which is going to really create additional challenges with the Delta variant. We've got holiday gatherings. We in New York City have decided to use a preemptive strike to really do something bold to stop the further growth of COVID and the dangers it's causing to all of us. So as of today, we're going to announce a first-in-the-nation measure. Our health commissioner will announce a vaccine mandate for private sector employers across the board. All private sector employers in New York City will be covered by this vaccine mandate as of December 27th. We're going to have some other measures as well to really focus on maximizing vaccination quickly so we can get ahead of Omicron and all the other challenges we're facing right now with COVID.
Get ahead of it. There's so much here. First of all, we don't even know enough about Omicron to know whether we should be taking any additional steps whatsoever. If anything, what we know so far is that it is likely to be milder than Delta based on the preliminary data of how sick people with Omicron get. Okay, so this panic seems completely out of place with what the facts actually, the data actually tells us. But beyond that, all private businesses, the mayor must know that there are large double-digit percentages of different demographics in the city of New York that currently aren't vaccinated to the point where they would pass his test, which means what, they're all going to get fired? The city's going to sue them into oblivion? Vaccine mandates for children 5 to 11? Boosters mandated within 2 weeks? You're going to have to get a booster shot? Some people just got their shots a month or two ago. Now they have to get a booster? How the hell is that going to work? I mean, it's just crazy, folks. These people have lost their minds. It doesn't matter what we see. It doesn't matter that every time they tell us to do something because the following will happen, and it doesn't happen the way they say it will, they're always wrong, and they say, oh, well, do more of what we told you. Speaking of do more of what we told you that was wrong, there's nobody that exemplifies that more than the evil tyrant healthcare smurf Fauci, who's out there saying, yeah, you know how we banned travel from some from some countries in southern Africa? We're going to get rid of those bans, in a reasonable amount of time. Watch.
Well, Jake, that ban was done at a time when we were really in the dark. We had no idea what was going on, except that there seemed to have been an explosion of cases of Omicron in South Africa. So when the ban was put on, it was put to give us time to figure out just what is going on. Now, as you mentioned, as we're getting more and more information about cases in our own country and worldwide, we're looking at that very carefully on a daily basis. Hopefully, we'll be able to lift that ban within a quite reasonable period of time. I mean, we all feel very badly about the hardship that might have put upon not only South Africa, but the other African countries. And for that reason, in real time, literally on a daily basis, we're reevaluating that policy.
Within a reasonable amount of time, we're reevaluating. It's a stupid policy. It was stupid when they announced it. It's stupid now.